So, Angie, you're from North Carolina.
I'm from North Carolina.
Awesome. And you're here in New York with us.
Yes.
You had a nodular basal cell on your chin about May.
May 2025, about 7 months ago, I think. And we had heard about your office and the procedure, and decided to come up, and I'm glad we did. It was really, I feel like a pretty easy procedure, and there wasn't any pain.
How long did it take, would you say?
About 5 to 10 minutes for the actual procedure. You know, there's a little prep time, maybe 30 minutes of the numbing, and then it was really fast.
And any stitches, scarring?
No stitches were needed, and there hasn't been any scarring. So, and I actually have like a family history of keloids and things, scarring from my dad's side. So that was something I was worried about, but I haven't had any scarring at all.
So after the biopsy, what did they tell you would be the next steps prior to you learning about the laser?
They wanted to schedule Mohs surgery right away, and that was all the options I had down there. So.
And did they talk about flaps or grafts or having to move skin around at all?
Yes, they said that it would probably have to have I think a graft or like and like filler put in. So it sounded pretty intense.
So, giving the two procedures, the laser versus what they told you about the Mohs, you're happy with your choice?
Definitely, yes, definitely. I mean, hopefully, if I ever have to, I don't hope that I ever have to have another procedure done, but if I did, that's what I would do.
And
sure.
What would you tell to people who were considering Mohs versus maybe now having learned about laser?
I would say to do what you could to try the laser and see, you know, just take that option first. You know, maybe the Mohs is like necessary in some cases, but for me, this worked, I think, really well, and it was worth it.
So it was right here on your left chin, right?
It was here, yeah.
And you really can't even see anything.
No,
You
I couldn't
really
tell
well.
you exactly where it was even
Yeah.
anymore. So I'm not sure, but yeah.
That's terrific.
Mm-hmm.
And now that you've had a skin cancer, I think you mentioned you were going to be more diligent about sun protection. Can you tell me a little bit more about that?
Sure, yeah. I grew up like down in South Florida, so I went to the beach a lot when I was younger, and so I think that could be what maybe had caused this to have to come out. But since that time, and since I found out about this, I'm being really diligent about putting sunscreen on my face every day, wearing at least SPF 50, and this summer I didn't go in the sun, you know, trying to be very much more diligent about sun protection now.
I think
using
that's,
a hat.
Oh, I love that.
Yeah.
Hat with a 4-inch brim if you can.
Right.
That's really wonderful. And I think what I'd like patients to know is similarly what you're saying, despite what we've done in the past, what we really do now going forward still makes a big difference.
Yes.
As to whether that'll be the extra ultraviolet light that you'll get today that could make a skin cancer. So
Yeah.
I'm so glad you're being so protective with your skin.
Thank you.
You're welcome.
And I think you mentioned too that it was it might be protected. The procedure could possibly be protective from things coming out in the future. So
Yes,
that
I
was
do have
another point.
100%. I do have colleagues who've done studies using the same laser in different settings to actually help prevent cancer to the tune of 60 to 70%.
Wow.
So
That's
it's been really great movement with laser in the treatment of precancerous growth and skin cancer. Was there anything else that you would say to somebody considering, you know, laser treatment or to protect themselves in the future from skin cancer? Like getting checked regularly by their dermatologist.
Yeah, I think it's important to.
Dermatologist.
I didn't expect it. It kind of surprised me. So it is important, I think, to get checked regularly as you get older too, and be diligent about protection whenever you do go in the sun. but if this was to happen, I would say this laser surgery was pretty amazing to me. So the laser treatment, and yeah.